Hello, I'm Dr. Crystal Marcia for Contemporary Pediatrics. Today I have the privilege of speaking with Dr. Anne Schuchat, an Assistant Surgeon General in the United States Public Health Service and Director of the CDC's National Center for Immunization and Respiratory Diseases. Dr. Schuchat, recent surveillance data on HPV vaccination rates showed modest year-on-year improvement among adolescent girls. What do you see as the key contributing factors for the lack of a more substantial growth?
You know, we're really frustrated with the minimal progress in HPV vaccination. When we've done extra research to understand the factors, we think there's communication problems happening. We think clinicians are not strongly recommending the vaccine for boys and girls at the 11 and 12-year-old visit. They're presenting it as something kind of optional. They're not presenting it in the same way that they present meningitis and Tdap vaccinations. We don't think clinicians even recognize that they're sending mixed messages, but our research with parents suggests that they are. We know that if clinicians would offer a strong recommendation and parents accepted, every time another vaccine is being given, an HPV vaccine was also being given for teens at the 11 or 12-year-old visit, we could have over 90% of teens with a first dose of HPV vaccine. So we think the secret here is in mainstreaming the vaccine, presenting it the same way as the other regular vaccines, and really protecting this generation from future cancers.
One of the things that came out of the report is that with boys, they're still in the minority, that not all that many of them are getting the HPV vaccination. Is there a different message or approach needed to promote the vaccination among teenage boys?
I think the recommendation for boys isn't well known, both with parents and with clinicians and with health plans. It's considered relatively recent, and I don't think we've really penetrated the mainstream yet. It's really important that boys and girls get HPV vaccination, that it's routine at 11 or 12, and we haven't really done a great job yet at getting the word out. So I think we're seeing uptake and increases in boys at a steeper rate than in girls, but it's still only about 35% of boys that have gotten that first dose. So we know we have a long way to go towards our targets.
You had alluded to some missed opportunities for recommending or administering the HPV vaccine. What steps could a community pediatrician take to better integrate HPV education and vaccination into their routine practice?
Now that the recommendations are for girls and boys, we think it's easier for the HPV vaccine to be mainstreamed. And so every time a community physician is seeing an 11 or 12-year-old, boy or girl, we hope that they'll say, today I recommend 3 vaccines. The HPV vaccine, the Tdap vaccine, and the meningitis vaccine. These vaccines prevent cancers, they prevent meningitis, and they prevent diphtheria, tetanus, and pertussis or whooping cough. I strongly recommend them. I get my own kids or my grandkids vaccinated, and I think this is the right thing to do. We also hope that clinicians would be able to answer the questions that parents have. Our research suggests that parents value the HPV vaccine as highly as they value the other routine vaccines, but they do have some questions. We have a great tip sheet that we recommend. I really recommend this for pediatricians. It takes the common questions that parents have and goes through some tested answers, message-tested answers that parents really understand, things that resonate with parents. We think it's good to talk about the HPV vaccine as an anti-cancer vaccine. We know parents want to know, is it safe? And of course, it's important to have information about safety for all of the vaccines. More than 60 million doses of HPV vaccine have been used in the United States, and it has a very strong safety record here. We also know parents wonder, is it long-lasting? You know, vaccinating at 11, these cancers show up in middle age. Well, yes, we do think the vaccine is long-lasting. Why is it given to 11 or 12-year-olds? Isn't that too soon? No, that's really the best time to give it, well before any sexual activity will occur and when the antibody levels that are produced are actually the highest. So our tip sheet, which is on our website at www.cdc.gov/vaccines, has great information of how to talk about HPV vaccine with your patients. And if it's possible for you guys to link to it, we can get you the particular site. But it's a way to, in a very short clinical encounter, get the key messages for parents that they need to know or that they want to know.
I know that there are several initiatives. You'd mentioned the website and other things that you're working on. Do you foresee, when you're looking into the future, some positive movement on the horizon in HPV vaccination rates?
You know, I hope we get some positive movement. It's too soon to say what the impact of our efforts is. We were a bit disappointed in the numbers that we got for 2013. Our bigger push on the HPV vaccination really started in the second half of last year. But as I'm looking at sort of spot check information for 2014, it's not as great as I'd like. So I think we do have a room for improvement there. But I hope clinicians will know that we at CDC and partners across the clinical spectrum, the American Academy of Pediatrics, and many other groups are really trying to help reinforce the hard job that you have, reinforce the work. We'll be doing some communication directly to parents and to teens, trying to get the consumers that are in your office more primed for the discussion that you'll have. So we hope you'll be seeing some social media, some PSAs, some bus posters and so forth about the importance of getting your kids protected against cancer through the HPV vaccine. That can make it easier for the clinician discussion. But we hope this can be a simple, efficient discussion and that clinicians can get their HPV vaccination rates up to the great rates that they've already achieved with Tdap and with the meningitis vaccine.
Well, thank you very much, Dr. Schuchat, for joining me today. For more information and HPV vaccination resources, I encourage you to visit the dedicated CDC website at www.cdc.gov/vaccines/youarethekey. This has been Dr. Crystal Murcia for Contemporary Pediatrics.